time to talk about health. Now, a lot of us use wearables, we use our cell phones to track various things about our health. Our phones and our watches can now check our heartbeat, check the balance with which we're walking, actually keep track of various things to do with health that sometimes helps us manage better, sometimes makes us uncomfortable about how much data these devices are actually collecting. There's an interesting development now from Google. Google is actually working very largely in public health. It is now teamed up with India to provide large scale public health to people across the country. This conversation is to understand how that will actually work, what the contours of that understanding is, and whether it will improve things for India, or is it likely to make those of us who take privacy very seriously a little more uncomfortable? To help us understand this and answer those questions for me, Bakul Patel, who's the Senior Director of Global Digital Health Strategy and Regulatory Health Strategy at Google, joins us right now. Mr. Patel, thank you for joining us. I understand, to put it very fundamentally for our audience to to sort of come up to speed with what you're discussing right now, Google is working on a future in which healthcare diagnosis and planning can be individualized to each of us using the data that's collected by our phones and our variables and various diagnostics. Is that correct? And you'll be using AI to make it smarter and faster.
Yeah, Faye, I think really good, but you're raising a really futuristic question, and this is really true. And I think once we wish we can sort of help people diagnose a lot of conditions, but let me go one step before that. We're actually doing this today already in India, and our mission and Google Health. What is Google Health? Is pretty much like it's a part of everything Google does, and what does that mean for health? So you aim to bring everyone everywhere live longer in longer, healthier lives. So that's sort of the mission statement for us. And the work that we do at Google Health is build products that people already use every day, from search to YouTube to Android to cloud, and includes wearables as well, right? So I think you mentioned wearables earlier. This is really, really powerful. As you start thinking about Pixel 3 watch that was just released, that has the most accurate heart rate sensor built as of today. If you think about Android, Health Connect is actually where people can connect their data, their personal data, securely on their phones. And I think those are the kind of things, examples. And I can go into a lot more examples, but just to give you a flavor of Google is involved in health today, and it's been involving in a very long time. I think the future, what you just painted, is more about the future capabilities of how AI is going to transform healthcare in the future, right? But we're in the middle of that journey. We're not in the futuristic world yet, but I can give you examples like, our recent research, which is open source, and it's a foundation model which others can build from. And we're partnering with a organization called SWASA that can actually detect TB from cough sounds. Now that's phenomenal research, right? If you can imagine that. Or you can take X-rays and just run it through the AI tools and detect somebody has TB or not. And those are the kind of things that our research becoming open source and giving people an enabling sort of technology that can take it to the next level for actually detecting or diagnosing diseases, as you can imagine. But that's like personally for people, right? If you just think about it from that perspective. But then if you think about the way sort of our technology platforms are used by many, many people across the world. And one of the key things is information. Giving people
Right.
the right information at the right time is really, really important. And I think our platforms do that really, really well. And if you just think about, then think about, okay, what does that mean for the caregiver? Because they're an important piece of the puzzle in healthcare itself, right? And just thinking through that and saying, what can we do to enable those caregivers? And these diagnostic tools I just outlined are the tools that we can do. And then you have other partners like the Government of India and National Health Authority that is trying to sort of build the ecosystem and the architecture for digital health to become reality. So those are kind of the things that I would say that we are working towards and working currently on.
What are you doing with Government of India right now?
So there's a couple things, right? So either one is directly with Government of India. We have an open source project, our Google research team, and provided a set of tools that's open source that allows for the ABDM infrastructure to be easily adopted by developers who are trying to connect to the infrastructure that's at that ABDM. So that's the what we call it is a wrapper that allows integration to the system at scale much quicker because we build all the mechanics that goes with it really, and open source it, developers can sort of take it and implement it really quickly. That's like number one. Number two, I think I will say that ABID, I think that's a big push from the National Health Authority to have every Indians to have that. We partnered with Eka Care, who is partnering with the NHA, and now we're going to take Haba IDs, and you'll see this in the next year, and that Haba IDs will now be available on Google Wallet on your Android phones. So
What does that
what
what
that
does that mean? What ID is that? How does it work?
just
Yeah.
think about it as a health ID, right? And that ID is associated with participating people with the government of India who are connected for the health information that the government is providing to the people. So what we are doing here is we're partnering with Eka Care, which is a company that makes it easy for the IDs to show up on Google Wallet. And that wallet is now secure, and we'll be requiring people to use passcode and pins and fingerprints to sort of access that. So we keep in top of mind that security and privacy is a key thing. Will be on the ID itself.
Well, so if I've understood correctly, the Ayushman Bharat digital mission, which is basically a massive insurance policy that's offered to people of India from government across the board, the digitization portion of it will involve an ID that you are working on adding to the Google Wallet, so people can just carry it around in their phones, and when they arrive at the hospital, they don't need any other documentation except what's already on their phone.
Just exactly, you're exactly right, right? Making it so easy for people to give access to that ID that people can just walk and go to the care facilities with that.
Bakul, I have two, questions about privacy here, which is obviously going to come up because on one hand, what you're going to have is access to an enormous amount of healthcare data of Indian citizens. I do understand that this will be extremely useful in studies for cancer, for tuberculosis, for diabetes, issues that Indians face in perhaps the largest numbers in the world right now. The second aspect is private data of every single individual that's currently being logged on their phones and their wearables that Google will then be able to harness. How are you going to respect the privacy of every single Indian, including the poorest, who perhaps, if were given the choice, would sacrifice privacy for healthcare? But as an organization, as Google, how will you prioritize their privacy?
Let me just be extremely clear, right? I think when we surface health ID cards, just imagine that as health ID cards on Google Wallet, we're not connecting and seeing their personal data. It is on the phone for the users to sort of maintain, and it's not available for anybody else outside of the phone to sort of have access to that. So I think that is sort of one of the fundamental things we should think about. And the surfacing of ID is more about making it easy and accessible for a lot of people. And think about this as you store your bunch of files, your pictures on your phone. That is not available for anybody else outside of you and your phone, and it's protected by a password. So that's exactly how it is. The data does not leave the phone, a smartphone, or the device itself. It just stays in there, and it doesn't have access. Nobody else has access other than you as an individual. So from that perspective, and then when I mentioned earlier, people will have to use their passcode and pins and fingerprints, is really giving that purposeful protection layer that people cannot just willy-nilly show up and just let people others sort of accidentally use their data.
So if I've understood this correctly, I mean, we are talking, but let's talk about an individual farmer, who lives in rural India, who's used your partnership with Apollo to be diagnosed with tuberculosis, and then uses the Ayushman Bharat card on his Google phone to go to the hospital and avail of treatment. And I do understand you're also working at improving administrative, details inside of hospitals, which means handovers between nurses, actual data, actual, administrative work. Does all of this eventually form a file of a medical history for this individual farmer? Where does that file rest? Who has access to it?
Yeah, so the health records for a person is with the hospital systems itself, and even if they were within on a Google Cloud basis, on a Google Cloud, you can imagine a domain that's been created for that customer. In this case, there's a big large hospital. They will have their own domain, and that domain itself is private to that customer. Nobody else access. Like there's no other person, including Google, have access to that information that lies into that cloud infrastructure. And it could be any other cloud infrastructure, not just Google, but any cloud infrastructure. That's how the technology works, right? So that is important to understand that within the health system itself, it's private. Within and all that information that the farmer actually now goes and exchanges with the hospital system XYZ, it will be in that hospital system XYZ. Just like imagine you have paper records that somebody writes notes on and you keep it in a file in a hospital. That is the digital version of that stays within the hospital.
I do want to understand how you're working to help people in administration. My understanding is that Google is working to help hospital administration dedicate more time to care and take less time out of actually filling out those forms and those files. What is it you're doing exactly?
Yeah. So what I don't know if I'm going to use jargon here, but then excuse me for that. There's a clinical intelligence engine, which is actually another tool that Google has developed, and we actually allowed. It's kind of a foundation model that our customers, like a hospital system, will actually take that and build it for their own systems. And the intelligent engine, you can imagine. I'm going to make it very simple. Imagine they have built it and they have access to the patient record or a patient X is showing up. The engine can sort of take that record for that person and make it simple enough for the providers to understand the history, what was last done with the person, and so they can create a plan of action or care for that person who has been visiting. So that's instead of so the alternative to that is somebody has to go scroll or flip pages to make sure that they have seen the history for that patient. Now, this engine that I'm talking about, clinical intelligence engine, is providing exactly that intelligence into a person's record. But remember, this is built by the hospital system, not by Google. We provided the base technology that you can think about as a guiding tool that hospitals can use.
If we're using AI for diagnostics, one of the things that we're concerned about when it comes to generative AI across the world is the sort of bias that gets worked into the learning system. It could be far more dangerous when we're talking about health and diagnostics. What is Google doing to mitigate that risk of AI just mislearning some biases, which
Yeah.
are already in the
So
healthcare industry?
we take this extremely seriously, Faye. I think at Google, we want to be bold, but we also want to be extremely responsible. And we can't do it alone. I think generative AI is such a frontier that we're trying to get across very carefully. That's why I feel that when we use these technologies, it's better to use in low risk settings like administrative, sort of simplifying or just explaining what has happened from a nurse handover, systems like that. That can be rechecked and checked by humans, as you can see. So this happen. And when we start talking about how we start building technologies together with other people, we are going to learn what is it that these generative AI tools are going to do. How are you going to partner? How do you sort of minimize this bias? Equity is actually one of the paramount things that Google Health is really, really focused on. And I think And equity is a very broad word, right? I can imagine from a socioeconomic structure, from a race and identity structures, and any many other dimensions of that. And I think we need to make sure these technologies are serving
But
everyone,
I
not just
so
one.
forgive me. Now I'm going to stop you
Yeah.
here because of the jargon, but I don't understand how you're going to do that. How will you make sure? And let me put this basically. In India, we have excellent state of the art healthcare for people who have money, but for people who
Mhm.
don't have money, the reality is very very different. How will you,
Yes.
with AI, bridge that gap, or at least, in the very least, make sure the gap is not widened?
Yeah, I think you sort of heard me say this, right? The equity is beyond just race and identity. It's more about socioeconomic as well, just kind of what you're alluding to, right? There's a socioeconomic strata that is different than the other stratas that exist. And I think if you think about care and access to care, I think that's when I spoke about our goal to help millions everywhere have access to healthcare using our technology. That's one of the things I think we need to focus on. And I think that is driven by information, that's driven by insights, and that's driven by infrastructure. If you think about those things and you hit it from, and we sort of look at it from what does the consumers need? What does the caregivers need? What does the health infrastructure need? Is kind of where we are sort of working towards. Now and let me go back to your original question about training models with data. And if you start thinking about training models with data, you have to be careful. Not every model is usable for everything. In fact, we have our models is is when we say foundation models, they're based on a foundation of data that's going to be trained on. But the next level, the last mile, would have to be done in the local setting, local sort of aspects, etc. And this is kind of how we are looking at amplifying what are the things that we could do better in different settings, and that's one way to think about it. But also, if you look at some of the projects that we have done in understanding how, I don't know if you heard the project Arman or not, where we help expectant mothers. Yeah, so, and that's where technology can actually, I mean, if you heard about that product, I think, but that's where technology can predict which which mother is actually going to fall out of the system, and can it actually be, can we use the workers, the call centers to sort of reach out to those people to help bridge that gap. And that is the power of technology, right? It's not going to be just about training. It's not just going to be about building technology. I think we need to build together with people to make sure that we are addressing those gaps.
What areas of healthcare specifically do you believe AI will be most useful for in India? Are we talking tuberculosis? Are we skin cancer, breast cancer? What diagnostics or what specialities will it be deployed most in?
I think all of them are a pretty prime game. I think this goes in line with, TB is one of the things that we are focused on today. And as we learn more, as we sort of have information that can build some of those foundation models of research, sort of goes beyond. I mean, I don't know if you heard, but you'll probably hear this today in terms of where we're talking about. We have a foundation model called HEAR, HEAR, that we are working with a company, with an organization called Swasa, that's trying to detect TB from cough sounds. How exciting is that, right? So now you have this multimodal capabilities, not just about X-rays, which was done many, 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 many years ago and continually being done, but you are now seeing advantages of being able to hear, being able to see, and being able to sort of go forward with these kind of diagnostic. But the science is still evolving, right? I think we still need to work through some of these things. It needs to be proved out, need to be make it more available for general population. So I feel like we are in the beginnings of that world of how AI and this phenomenal technology that can now hear and see can actually be used for this diagnosis.
All right. Bakul Patel, thank you so much for speaking with me here. I do appreciate the conversation, and we look forward to the data or the technology that Google hopes to deploy in India. We keep a close eye on it. For our audience, remember, like, share, subscribe, and sign up for our membership. Thank you for watching.